Hi, Dr. William Portuese in Seattle. Today we're talking about reduction of the hanging columella with a closed rhinoplasty approach. The columella itself is this portion of the nose right here that is the dividing line from the left nostril to the right nostril, and behind the columella is the start of the nasal septum. And the septum is simply the dividing line between the left lane and the right lane of airflow. But the hanging columella simply is hanging down too much in this location and gives a bottom-heavy look to the nose. The hanging columella occurs from either patients were born that way or it wasn't attended to at the time of a primary rhinoplasty. And so a revision rhinoplasty is sometimes required to reduce the hanging columella. And the reason that the hanging columella occurs after a primary rhinoplasty is because once you shave the hump down, the columella itself tends to bowstring downwards or become more bottom heavy of a look on the nose. So when we take the hump down, we also have to adjust the columella. And we do that by trimming back a little bit of the excess cartilage and excess skin in that location so that it doesn't look like the inside skin of your nose is hanging on the outside. The columellaplasty is usually an integral component of a rhinoplasty procedure. It can be done as a standalone procedure, but it's usually as part of a full rhinoplasty. Based on where I take the extra skin and cartilage out of the columella, I can rotate the tip upwards or I can rotate the tip downwards, depending upon what we're trying to accomplish. Some patients just want to reduce the total hanging columella, so we just reduce that equally. But I can lift the tip or derotate the tip downward when needed. The columellaplasty itself can be performed as a standalone procedure, but it's most commonly performed as part of a full rhinoplasty procedure. The surgery is performed under general anesthesia by a board-certified physician anesthesiologist here in our Medicare certified outpatient surgery center for patient safety and comfort. After a columellaplasty, the cast is applied across the bridge of the nose. The sutures are dissolvable. The cast comes off in about a week. Anticipate about 2 weeks of visible bruising and swelling after the surgery. Patients notice their reduction in the hanging columella immediately, even with a cast on. They notice how their columella has been tucked in and it's not so prominent. And then they get about 2 weeks of bruising and swelling. Full healing on the nose takes about a year. However, about 70% of the swelling is gone in a month, and about 90% of the swelling is gone at about 3 months after the surgery. This is a closed rhinoplasty procedure where all of the incisions are placed on the inside of the nose. No external incisions are required. No packing is placed on the inside of the nose. So this patient has what's called a hanging columella. She literally has over 1/4 of an inch of skin, nasal skin, hanging out of the outside of her nose. And it just gives her a very bottom-heavy look, a short upper lip, and it's just not balanced. This nose is out of balance. So I went in through a closed rhinoplasty approach. I also shaved down a little bit of her dorsal hump and removed cartilage and skin from inside her nostril along her columella to give her a more alar columellar relationship that's much more pleasing and aesthetic, so that her nose looks much more balanced rather than being so bottom heavy in appearance. What I like to see is that the patients get such a significant improvement, but it looks very natural and it doesn't look like they've ever had a rhinoplasty. They just look better, but nobody can quite figure out why they look better. The key is to not draw attention to the nose. The key is to draw attention to the whole facial features and make sure the nose is balanced. But what we're trying to do is make the nose look less prominent, so that I'm trying to blend the nose in so that people look past the nose and there's just not a detractor like that. That's just kind of the focus, which draws your eyes right to it.